Hello, my name is Chantel Young, and this is
Richmond Santos. We're here to present Pediatric Advanced Registered Nurse Practitioner.
So why did we pick this topic? So we picked the topic to Pediatric Advanced Registered Nurse Practitioner because it's a very rewarding career. It takes a very special, compassionate, and patient and resourceful nurse to become a Pediatric ARNP. A pediatric ARNP requires special skills. It requires developing a rapport with children, critical thinking skills, and also the possess the art distraction. So today we will be going in and taking a deeper look on the requirements, the education, the economics, and also the healthcare reform.
To start off, I want to talk about the requirements. At least a minimum 1 year registered nurse in pediatric nursing, but they recommend at least 2 years as a registered nurse in a pediatric care setting. It's recommended prior to the application of your Pediatric Advanced Registered Nurse Practitioner program. Now, continue with the education. A bachelor's degree from nursing from an accredited nursing program is recommended. And once you have your bachelor's, of course, you're going to have to take the NCLEX exam. Then you have two ways you could go get your master's degrees in nursing, the MSN, or your doctorate of nursing, the DNP, to become certified as a nurse practitioner. Now, during this program, you have to take courses related to child health and psychology. On top of that, you have to complete 500 facility supervised clinical hours related to pediatric nurse practitioner and its population. The different licensures you can get is the American Nurses Credential Center, the ANTC, and the Pediatric Nursing Certification Board, the PNCB, require applicants to have their current RN license. Also, you have to apply to take the Pediatric Primary Nurse Practitioner exam. That's administered by the American Nurses Credential Center or the Pediatric Nursing Certification Board to earn their certification. Now, going over the different certifications, the PNCB offers 2 certifications in pediatric care. They're both recognized in all 50 states, and yearly recertification and 15 hours of continuing education is required. But a wide variety of options are offered for meeting the annual education requirement. Now, there's the Pediatric Nurse Practitioner Acute Care, the ACPNP, and you can also take the Pediatric Nurse Practitioner Primary Care, PCPNP.
So, job responsibilities. Pediatric nurse practitioners are able to perform health maintenance. This includes well child care, immunizations, vaccinations, developmental screening for infants, children, and young adults, diagnosis and treatment of common illnesses, physical exams, administer medication, and provide supportive care to dying children. So the standards of care and also the scope of practice. Different states have different scopes of practice. I was unable to find Florida's, but I was able to find Alabama's. So nurse practitioners are able to arrange inpatient admissions, discharges, and transfers. They are also able to perform complete, detailed, and accurate health histories. They're able to perform health physicals, and also able to initiate therapeutic regimen, including medical devices and medications. Also, in case of emergency, they're able to stabilize patients. Organizations. Some common good organizations that pediatric nurse practitioners can get into are NAP, and that's the National Association of Pediatric Nurse Practitioners, the AANP, and that's the American Association of Nurse Practitioners, and then the PNP, the Association of Facilities of Pediatric Nurse Practitioners. A great website is the pncb.org, and that's the Pediatric Nursing Certification Board.
I just want to talk about the nursing shortage. There's a big nursing shortage, but according to the Bureau of Labor Statistics, it's expected at least a 22% rise during 2008 through 2018 decade. Also, according to the Bureau of Labor Statistics, there's approximately about 581,000 more jobs coming into the market. So that's definitely going to help with the nursing shortage. Talking about the nursing outcome, one of the most important things is the quality of care. Now, the pediatric nurse practitioner, they offer the same care as pediatricians. As far as the compliance with the clinical guidelines, they practice within the scopes relating to diagnosis and the combination of clinical data and evidence base, which in return will decrease the mortality rate, patient mortality rate. Also, they decrease in cost to patient and prevention. They're more affordable than seeing a pediatrician.
So the healthcare reform. In 2010, Congress passed the Affordable Care Act, which was signed into law by President Obama. The intent of this reform was to provide seamless, affordable, accessible, quality care. The organization recognized that nurses were a partner because we work so close to the community, and that we also was a part of that change. From this, they stem 4 key concepts, and the first one was nurses should practice to the full extent of their education. Nurses should achieve higher levels of education. Nurses should be full partners, and effective workforce planning and policy making. From that, they learned that they should remove the scope of practice, more residency programs, ensure nurses engage in lifelong learning, and enable nurses to lead in the community. Healthcare economics. So, fee for diagnosis. Fee for diagnosis is basically the healthcare, you're paying for a diagnosis, a fixed amount which a diagnosis is paid for. But a diagnosis must be made. And then you have fee of service. The patient decides which service they want and which service they don't. The service that they want, they will pay for it. And then capitation. This is the provider agrees to a fixed amount that they will pay for a service during a certain time period. And it doesn't matter if that service is above or below. Examples is HMO and PPO. So one of the research, evidence-based practice research, it was the neonatal intensive care unit program reduces length of stay in premature infants and improves the mental health outcomes in parents. This was a key concept behind because parents were able to participate in the care of their infants, and also because they had activities that assisted parents in implementing experimental information. So legal issues. Some legal issues that nurse practitioners should look out for is employment contracts. Sometimes we get in a hurry and we just sign anything. Nurse practitioners should view their contracts and make sure that it will not harm them in the future, because sometimes if you sign a contract, it can limit your opportunities. Also, a lot of nurse practitioners are becoming into issues with firing and termination. Watch what you post on Facebook. Make sure you read your policy and procedures so you make sure that you're covered. And also, you must see the patient before you file medical records. So make sure you do everything right, because providers are not able to fire you based off your religion, age, or race. And then improper incidents of billing. In the past, Medicare was able to bill the facilities when it wasn't filed properly, but now they're billing nurse practitioners because they're saying that they know the rules and the laws with Medicare filing. So make sure you be careful when filing for Medicare. So what is quality care? Quality care is going above and beyond expectations. The patient and the family isn't involved. It's meeting every patient's expectations and making sure that patient is the source and focus of care. And that concludes our presentation. Thank you.
Thank you. Thank you for your time.